Welcome to POC Nurse. Let's do a CCRN question. Question. A patient is on mechanical ventilation for ARDS. The plateau pressure is 35 centimeters of water, and the tidal volume is set to 6 mL per kilogram, usually of ideal body weight. What is the next best intervention? Here are the answers. A. Increase tidal volume to 8 mLs per kilogram of ideal body weight. B. Increase P. C. Decrease tidal volume. D. Start prone positioning. And the answer is C. Decrease tidal volume. So usually the recommended therapy for patients with ARDS is to start with a low tidal volume of 6 mLs per kilogram of ideal body weight, and to also maintain a plateau pressure of 30 centimeters of water. So here we see that the plateau pressure is high at 35 centimeters of water instead of 30. So for me, the goal of this answer would be to reduce that plateau pressure. And let's see why this answer is correct. So NCC is correct because of the following. The goal in ARDS is to keep plateau pressures below 30 centimeters of water. If plateau pressure exceeds 30 centimeters of water, there's further reduction in tidal volume is needed to prevent ventilator-induced lung injury. So the plateau pressure is basically the pressure in the lungs when the patient gets a breath and that breath is held in the lungs. It shows compliance in the lungs. So if plateau pressure is going up, it means the lungs are sort of stiff. So if you increase the tidal volume that you're pushing into the lungs, it's like pushing air into a stiff balloon. At some point, it's going to pop. So, to reduce the chances that ventilator induced lung injury will occur in the patient that has a high plateau pressure already, you want to reduce the tidal volume, because the tidal volume is the major thing that's applying pressure to the lungs. If it's high and plateau pressure is high, you increase the chance that this patient is going to experience lung injury. So a decrease in tidal volume is the correct answer because you want to reduce the plateau pressure in the patient's lungs. A, increased tidal volume to 8 mLs per kilogram of ideal body weight is incorrect because increasing the tidal volume exposes the patient to an increased chance of lung injury, ventilator-induced lung injury. B is wrong. B says increase PEEP. PEEP can help with oxygenation, but it won't lower plateau pressure. And increasing the PEEP could also lead to barotrauma and lung injury. D, start prone positioning. In this case, we're trying to address the plateau pressure. We're not trying to improve oxygenation. So what prone positioning does is improve oxygenation. So blood, it will facilitate or increase gas exchange at the alveoli level when you prone the patient, but it will not help improve the plateau pressure in this patient's lungs. But prone positioning is beneficial in ARDS to improve oxygenation, but the priority here is reducing plateau pressure. Thanks for watching. Please like, share, and subscribe, and I will see you in the next video. Bye bye now.